Through the Looking Glass. This week, I have a very special person, Taha Khan, joining me on my podcast. She is someone who was born in India and since then made her way around the globe and currently living in Boston, practicing medicine, who has multiple degrees with her MD from Dalhousie University in Canada, and she has a master's in public health from Harvard University. She is also a founder and CEO of Child Awareness Project, which is a award-winning youth-led nonprofit organization. How are you? Introduce yourself to the audience. Thank you so much for coming on.
Hi, Lavanya. Thank you so much for having me on your podcast. So, a little bit about me. I think you've done quite a good job introducing me, but as you mentioned, I am a physician, I'm a child rights activist. I care about the intersection of both. How do we ensure that we are protecting our most vulnerable kids? I am specializing in the field of pediatric neurology, which means baby brains. So my focus is how do we protect the most vulnerable babies? How do we ensure that all kids meet their fullest potential? And I'm excited to talk more about that through this podcast.
I'm excited to hear your thoughts on all of the things that you mentioned and hopefully some insightful advice that you could give to people who are listening and just share your story. First, I want to kind of get back into your upbringing and your education. Take me back to when you were younger. What inspired you to become a doctor?
So as cliche as it sounds, I went into medicine because I wanted to help people, but my true interest in medicine started because of ancient Egypt. And the connection is weird. I remember in school we were learning about mummies and mummification and how that the process occurs, and that got me interested in anatomy and the human body. I had some flashcards that my family had brought for me to learn about different parts of the body and sort of just learn more about the human body. And I think that made me realize that I had an inclination to lean more into the sciences, specifically biology. And I just sort of knew that, yeah, medicine seems like a great career, and I think I want to do that. I, of course, did not understand the full scope of what medicine was or what that entails, just beyond the fascination of anatomy. But I think this is what got me started.
How old were you?
I was 10.
Yeah, that seems about the time when you start thinking about, what do I want to be when I grow up?
hmm
And I'm impressed that you stuck with what you thought as a child. I think most people can't say that they're living out their childhood dream. And I also love the connection with like just Egypt and archaeology. I actually also I wanted to be an archaeologist when I was younger, but it's probably not, a thriving profession. So I'm glad you found your way to medicine. That's awesome. Thank you for
Thank
sharing.
you.
Did you have like any doubts when you were, getting into the studies of medicine, like college or high school, where you were, maybe like not sure if this is what you wanted to do? Because it's a pretty big commitment to go to medical school and like follow through. And there's so many steps after that too, as you know.
Initially, I just kept telling myself, like, yes, I want to do medicine. I knew that for a fact. And I kept telling a lot of people, I said that I want to be a doctor. It was a given, honestly. It was like, yes, I'm going to be a doctor. It was so hard for me to think of an alternative career, to the point that during one of my med school interviews, someone had asked me, what would you do if you were not a doctor? And that question stumped me because I honestly could not think of what else I would do. I felt like medicine was the only thing I'd ever considered. So I stuck through with that. And I wouldn't lie, medicine has been challenging. There is a lot of studying involved, and it is the analogy that is frequently used. It's like drinking water out of a fire hose, and that is not a lie. It's a lot.
You're being humble, like you more than got through it. I've always known you to thrive in your educational pursuits. And you have like an MD and a master's. You've, far exceeded expectations. But that's
Thank
amazing. I'm glad you stuck with it. There's always something that isn't going to come easy to you, right? And
you.
I'm sure there's a lot of situations that would have come up where maybe your professors or your peers or your maybe people in your work organization now where they might have maybe like underestimating you, and maybe didn't believe in you. How did you handle that situation?
I think the biggest thing that we deal with, especially as women, women of color, is imposter syndrome.
Yeah.
So, more than other people telling you that you're not good enough, it's that voice inside that's like, yeah, you don't belong here. Like, I don't know how you got this far. You're not good enough. And I think that's like the biggest thing that I've had to deal with. It's along the way, I'm like, how did I end up here? Am I as good as my peers? And I think that's the question that I've had to teach myself that this is not the question. There are people, it's harder for women of color to reach positions of power, of influence, and if women are able to get there, I think it's a testament to their abilities and it's a testament to who they are. And I don't see people who are represented in the majority questioning themselves as much. So I think imposter syndrome is probably the biggest obstacle.
Definitely felt imposter syndrome myself as well, in pretty much like anything that I pursue. And it is this, voice in your head of, am I good enough to do something? And the answer is, you most likely are more than capable of doing whatever that you're pursuing, but you have this, I think, both internal and external, build up a fear maybe that you aren't good enough to do something. And that is something that you have to work past, and something that I've definitely struggled with. Do you have any suggestions for how to get past imposter syndrome?
Again, I'm full of cliche advice today, but just believe in yourself. I mean, there are people. The fact that you're questioning yourself means that you understand that you are human and therefore you have flaws and you have limitations. And honestly, overconfidence is probably the worst thing, especially in a career like medicine. So the fact that you even have that inkling and you're sort of checking yourself periodically means that you know your limitations, and that is actually the biggest skill that anyone can have in this profession. So I would say that if you are starting to doubt yourself, that means that you actually are really good at your job.
Yeah, it's
As
actually probably a really good
counterintuitive as
rule of
that
thumb.
is.
Yeah, yeah, totally. Especially with medicine, you're right. Like, we definitely want our doctors to be thinking twice, or
Yeah.
wanting second opinions and stuff. But to add to what you were hitting on imposter syndrome, I think the biggest thing for me is, sometimes I'll hit on the external factors since you hit on the internal ones. I've definitely noticed, like when I was, in undergrad, and I'm sure there's other examples like since then I could give, where there's always going to be some people who, and it's not about you, it's definitely a reflection of like their own insecurities and doubts, where they might plant like seeds of, oh, isn't engineering really hard, or say stuff like, oh well, like, she's not that good at her job, or like, oh, she's too quiet, or like something like that, where people will build up, things that maybe makes you doubt yourself and kind of stunt your growth a little bit in your, um, chosen career. And I think those little things are definitely all the external factors that affects you and your self-confidence over time. And you start kind of doubting yourself, like, well, maybe I'm not good enough, like so and so said so, or so and so doesn't believe in me, and that person is this, someone who's in power, and maybe I should listen to them. And I feel like this is super predominant, and I'm sure it's, true in medicine too, but in engineering, there's already not that many girls who enroll in engineering, in general. And on top of that, there is this narrative of like people saying, "Oh, engineering is so hard. Like, don't you want to do something like easier or something like that?" And I feel like there's all these like bad advice that people essentially listen to, but you kind of have to have like the belief in yourself of like, you know what, like I don't care if someone hasn't walked this path before, but I'm gonna do it because I feel this intrinsic motivation to do that. You can probably relate to that as well. If you didn't get your, affirmations from other people, you had to affirm yourself that I have a reason as to why I want to become a doctor. I want to help people, and stick to that, and face the challenge, and not steer off your path. And that's a really admirable quality. But at the same time, the best of us will feel like an imposter, and I can even add to like my creative endeavors now with, podcasting. I definitely feel like an imposter all the time because, it's like I don't have a degree in entertainment, or I don't have, it's not my full time job. I'm not an expert. I'm not, a speaker by profession, and all these things, right? There's always a million things that you could say against why you should do something. Those are the moments where you should, think of the things why not, right? So
I agree. And I think you're doing a great job, by the way.
thank you. You're very sweet. I'm trying. Tell me about, being a female doctor. How has that path been for you?
It's definitely been interesting in
Yeah,
medicine. You sort of hear about how female doctors are undervalued and how things are hard, and definitely female doctors are catching up and we're changing the status quo. There's still times when I walk in and I'm in my scrubs and a patient looks at me and says that, oh, the nurse is here. And
right.
that belief that, oh, if it's a lady, if it's a female, it's probably a nurse. Or if I'm working with male medical students as a senior resident, sometimes patients turn to them and start talking to them because they just assume that because they're male and white, they're probably superior or my superior. And it's definitely interesting to see how that dynamic plays out. There's a long way to go in terms of shifting the mentality of people around you. Like I said, we do have doctors on television who are female. I think Meredith Grey is a great example of that. But you unfortunately people still view female doctors as a new sort of a novelty. And what's interesting is that studies have actually shown that patients have better outcomes when they're treated by female doctors. And some of that I wonder is whether some of that stems from that imposter syndrome and the act of questioning yourself before every decision, which, like you said, doctors should do.
Yeah, there's definitely the image of when you think of a doctor, you think of, an older white man in a like lab coat, and that's the image that has been, it's been the image for so long. I think
Mhm.
sometimes we forget, like you said, that, we've come so far in terms of uh, women entering different professions and rising to leadership positions. But, if you think back like 50 years ago or like 70 years ago, there probably wasn't that many female doctors, right?
Mhm.
And that's not that long ago in the grand scheme of things. And I think, us as women in the workforce, we have to take a little bit responsibility to move the needle forward in our own ways, right? So in your example of like your just people in general, like, thinking that you're the nurse, or thinking that your students are superior to you because they happen to be male and white. What was your response in that situation? How did you correct them, and how did you take your ownership back in the room?
I think a lot of it is just reinforcing that, I would introduce myself as I'm Dr. Khan, I'm taking care of you today, and sort of just reinforcing that, and just reinforcing provider roles because it's not just a question of, how people view different races or ethnicities or genders, but it's also a question of safety because they need to know who their physician is. So I think just reinforcing that has gone a long way, and people are starting to see more and more doctors. There's who are women or other genders. The people are definitely starting to get more comfortable with the idea of female physicians. I remember I worked with a female surgeon, a neurosurgeon once, and she had a patient who basically refused to get operated on by her because he did not trust female surgeons, and he had this feeling that male surgeons were superior. So there are people who still think that way, unfortunately, and we're definitely making strides. We're making some progress in that area. I think we just need to do more.
Can completely understand like those situations do come up. And you're right. Like I think we have to look at the collective whole picture of how we can make those changes and take ownership where you can. In your example, ultimately that patient not wanting, it's their right to choose to get care from whoever they want. I don't think it's our responsibility to change that person's opinion, but it is your responsibility to be the best doctor that you can and set a good example to future doctors in general. It doesn't, not just women, right? So I want to know more about like going through your MD. Did you know that you want to get a master's? How was your thought process behind why you wanted both?
So I have a master's in public health. And when I did it, it was before COVID. So public health was this very confusing thing. People didn't quite understand. They're like, wait, this is not medicine. What is
Mhm.
public health? Like, what exactly do you do? And one of the things that I remembered thinking while I was studying medicine, while I was working with patients as a medical student, is how, as much as we want to bring about change and as much as we want to do for our patients, we're often limited by the systems we practice in. And the systems are different. So I've seen medicine in action in a few different countries, and every system, in my opinion, has its pros and cons. And there are things that need to be changed from people up there and people who are able to see what's happening on the ground and are able to use that information to influence health policies, legislation, and things like that. So, therefore, I knew that I wanted to help enact and bring upon some of that change and to use my clinical hands on experience to influence that. I've had some previous experience before my master's working on the topic of right to education, safe schools, refugee education, multilateral organizations, including the UN. So I knew that this is something that interested me. I knew that sometimes decisions are made higher up and you need voices from the ground to, like you said, move the needle. So I think one of the things I wanted to do through my master's is sort of marry both clinical medicine and policy and try to find that niche where I can see patients and figure out what are some of the problems that we're facing and what are we limited by, and try to make changes or at least push for changes so that we're able to make for a better healthcare system.
That's amazing. Thank you for explaining that. It actually makes a lot of sense because, me being in the business world, I do know that most of the time in most organizations, the decisions are being made by the managers and the executives, right? So, and that person might not necessarily be someone who has a background or is actively involved in that. In your example, the act of like giving care, I think it's really amazing that you've found this niche that you can dig into and put your own voice in. And I also really love what you said about, there's not a diversity of voices maybe that are being heard in the rooms that are where those decisions are being made. If everyone in the room is making decisions, if they're not being represented by the population that you see when you're walking around, our population is it's pretty diverse, especially in America. We have so many cultures and so many ethnicities coming together. And I think that also makes it important for you to add your voice as a South Asian and as a woman, as a Muslim in that room, because you're going to be able to represent those communities that you're part of in the best way that you can, right? So I'm excited to see where that goes for you. But at the same time, it can be a challenging position to be in to take on that responsibility to voice your opinions or push for policies that benefits certain people, right? So I want to know about your, viewpoint and mindset of how you try to voice your opinions and how you go about expressing your stance in general. You can pick any topic.
I think in terms of making things that I've learned along the way, because I think public health, clinical medicine, and advocacy are my triad of things that I'm interested in. And one of the ways that we try to put our point across is actually by sharing stories. Stories, believe it or not, are more powerful than numbers sometimes. So you can say like 1 million people are affected by this. Most people don't know what 1 million looks like. But if you are able to tell a story, and a lot of those stories come from clinical practice. So patients that I see, things, people I have interacted with, things that I have seen. So if I'm able to bring those stories into those rooms where decisions are being made, I think I've done my job. I am hopeful that that is enough to push for change in a positive direction. And I think that's the biggest thing that I have seen that is helpful, that moves people. Because people are humans, they're humans react to stories.
That because you're right, because we are, as a society, we're cultural beings, and stories are an integral part of that, right? Tell me an example or an anecdote that comes to mind where you had to maybe tell your own story about something and how you framed it.
So one of the things that I remember doing is, so as a member of the American Academy of Pediatrics, there was a paper that came out that highlighted that gun violence in America is responsible for a, an absurd number of deaths, in fact, becoming one of the leading causes of death in children. And so one of the things that we were pushing for as pediatricians or people in the medical community was gun control. And I was able to use some examples, including patients I had seen who suffered from PTSD after either seeing people being shot or having nightmares about hearing gunshots, or people who had lost loved ones because of gun violence. And I was able to put those stories across and bring it forth as the committee presented their report to lawmakers and people in charge. So I think that's like one of the ways and an easier way to do things, because as physicians, as clinicians, as people who interact with other people, we all have stories. We all have something that we have seen and which is what drives us to do what we do. And if we can tap into that story and share that with the world, I think that can make a huge difference. And most people don't know that.
Really right. Speaking up in general, I think it's a really difficult thing to do. And I feel like it comes so natural to you. Have you felt like you've always been heard? And in the situations where you didn't feel like you were heard, how did you handle it?
There are definitely times where you feel that other voices are louder than yours, and that is fine. But sometimes you feel like the loud voices are trying to suppress your voice, which is not fine. So there are definitely times where you are trying to put a point across, and people have stories that are different from your stories and might push things in a different direction. And I think that's why it's so important for all of us, especially people who are interested in advocacy, people who are interested in this sort of work, to ensure that they hone their skills as storytellers. And that's something that I'm still working on. I'm trying to be better at it, trying to work with people who've done a lot of this and trying to understand how do I best put my point across to a room full of people who have never been in my shoes, who've never seen what I have seen. How do I describe that to someone, and why am I standing here when I'm working like an 80-hour week? Why am I standing here, and why do I think this is so important that you need to listen and change this thing? So I think that's the biggest concern, that you want to make sure that you're a good storyteller, you're able to put your point across. And sometimes people don't want to listen to you, and some of it might be them just not fundamentally agreeing with what you're saying, or sometimes it's just that you're not describing to the fullest extent what's going on.
Yeah, there's just a couple of things that I want to dig deeper into from what you said.
Mm-hmm.
And yes, I completely agree with what you're saying. One, it can be, quite difficult to have the motivation to, like you
Mm-hmm.
said, after working 80 plus hours or whatever it is, to go be in the mindset and to be present to speak about something, right? So you have to be very much in tune with something that you're advocating for and have your mind clear on focusing on just that task and not necessarily worrying about other things that is on your plate, right? So I think getting people's focus can be very difficult because everyone is going through that where we're all trying to be in different places at the same time and do everything every day, right? So, and the other thing that I really like what you said was becoming a better storyteller and helping people be empathetic to something that you're going through. Everyone's going to have a different experience. They're going to have different issues that affect them, right? But that doesn't make one issue smaller or bigger. But sometimes it can feel like there's so much going on, there's so much news, and there's so many organizations working towards so many issues that we do have in our society as a whole and the world as a whole, right? So it can be overwhelming to know how to process all that information and to know, what is like accurate information. I think that can be difficult to deal with because there's a lot of misinformation out there. But in your experiences of being a storyteller and helping people, you mentioned having real life stories that you can refer to, adding the human factor in. If you're writing policies, if you work for the government, it can be very black and white, and I think you forget about how it's like affecting people in
Mm-hmm.
real life, right? So sometimes we all get focused on the fine print of things, that adding the human factor and the emotions behind it can really push the needle towards something that is creating a better world, right? So that's something that I know that you're very passionate about, and I really admire all of the work that you do in that arena. I want to know a little bit more about what advice you would give to people who want to have their voices expressed, but maybe they don't know how to do it correctly.
with with the advent of social media, I think that's been a beautiful thing in my opinion. We are able to get everyone is a story can be a storyteller. Everyone can be a person who is out there getting their words out. And that is a beautiful thing because you're not limited by who you have access to, your connections, your influence, or your job. All you need is internet connection and hopefully like a smartphone, which again, I mean, this is harder for a lot of people. Like people don't have access to those things as well. But I think we're definitely making it more and more accessible to join these platforms and to share what's going on in your lives, to share your stories. I think understanding how to best use social media to get your point across. And I've seen it from the start. I've for the past decade or so, or more than that now, that I've been on different forms of social media. I've seen the impact it's had both on my personal life, professional life, in my advocacy, how it's helped in so many different ways. A lot of people shy away from social media, tend to have an inactive presence on social media, but I think if someone is interested in advocacy, someone's interested in getting their story across, I think social media is the tool to use.
Yeah, I agree with that. And I think, getting your voice out there can be, it's essential if you're trying to advocate for something, right? That's a great point. I'm glad you brought that up. But so I do want to get into talking about your nonprofit organization. So tell me about how did CAP get started? What's the story behind it?
So I started Child Awareness Project, or CAP as you refer to it, when the idea started, I would say, when I was 15 years old. I was in 10th grade and I had heard this story about a child whose uncle worked at my dad's office, and she was at the beach with her family, and her mom turned away for a second and she was gone. Now, this was a 5-year-old child, and the family was not influential or didn't have the power to reach out to the top people in order to find their child. So they were ordinary people, and this was in India, in Chennai. So they went to the police and they wanted to file a report. The police refused, saying that, you know what, kids go missing all the time, she'll come back. And I think this entire story shocked me. And I knew she was missing, and I could not understand for the life of me why people didn't care, and that bothered me. I started reaching out to newspapers. I started cold calling different newspapers and television channels, telling them, I was like, hey, there's this 5-year-old who went missing. Nobody's really taking it seriously. And, her family is distraught because, like, losing a 5-year-old, like a child, is unimaginable. And I created a Facebook page to help find her. So it was initially called Search for Tamanna, and Tamanna was the child. And I eventually called one of the newspapers, like a student newspaper that I worked for. So I was doing this thing with Times of India as a student journalist. So I spoke to the editor of the student newspaper and told her about this. And I told her how no one seems to be interested. So then she reached out to editors to the main newspaper and said that, you know what, we will write an article about this, about her and about how she's missing. And they did. And that caught the attention of someone on the radio who called and was like, I want to cover this story. And that catapulted into this within a day or two, it catapulted to the extent that there were channels and newspapers who had initially refused to cover the story, who are now vying for the story because it became the next big thing. It became national news. And the media attention that her story caught was instrumental in her release. So she was found after 8 days. The people who had taken her, and they were believed to be human traffickers, left her, and the police speculated that this was because of all of the attention that her story got. And that's when I realized that, I was a 15-year-old. And as a 15-year-old, if I'm able to help get the process started of finding a child who was a victim of child trafficking, that there's untapped potential in young people. Like, age is just a number. You have the ability to do things, you can bring about change. And that led me to start Child Awareness Project. And the goal of our nonprofit was to ensure that we empower young people to take action on child rights issues. So things ranging from education to cyberbullying, girls' rights, like the whole spectrum of things. And our biggest thing is sort of working with young people, ensuring that they have the support, giving them that experience that, young people can bring about change. How do we ensure that you have the supports, you have the training to be able to do that? How do we encourage you to spread the word? So we would get young students from high school or college involved in this, and they would carry out workshops in schools that are maybe underserved. So these workshops would range from like cyberbullying and other issues. And that way we are talking about child rights to people where we want to make sure the awareness is spread out, but at the same time we're getting young people involved in that. We want to make sure that young people understand that they add value to society, they have a role to play, and they are more than capable of bringing about change.
I'm just blown away by this story. So I do want to go back and talk about it a little bit because
Mm-hmm.
I'm just unimaginable and like atrocious that you would try to report a child missing and there's no
Mm-hmm.
action that was being taken. It's so hard to digest that, right? And I'm
Mm-hmm.
sure, of course, like the family going through it would have felt like they had nowhere to turn and felt like they were really stuck, right? So,
Mm-hmm.
like, I'm just kind of like so shook that you had to go through that, and that situation of the way that you kind of like explained about how once you were able to get some traction on
Mm-hmm.
getting media attention, everyone wanted this story. And I like that, it was an experience that you had come across and you were a child yourself. Like you could have limited yourself and been like, well, I'm only 15, what can I do? And I'm sure the
Mm-hmm.
thought would have crossed your mind at one point, right? But
Yeah.
you decided that this was something that you saw happening and you knew that you could try to make a difference and you
Mm-hmm.
just took one step forward. And I think that's something that we can really, talk about here in this podcast, that maybe that's one of the takeaways is it's not always about like, no one goes from like, wakes up one day and they have this like huge nonprofit organization or like whatever it is, right? It's always about taking small step towards something that feels like you're adding value in society.
Of
And I
course.
think that's what you did in this situation. You were probably just thinking like one step ahead. So tell me more about how CAP had grown over the years, because probably been like more than 10 years now, right?
It's been a while since it started. I think that's sort of shaped advocacy as a whole, and
Mm.
how I've decided to, it sort of shaped my entire career to begin with. In terms of the organization itself, we're trying to revamp a few things, make sure it's still relevant, make sure that we definitely have a more global presence right now. So we have worked with UN online volunteers to come up with guides that can be distributed to schools, to come up with curricula for soft skills training. So a variety of things that we've worked on with them. So I think right now we are trying to make it more accessible, use social media to the best of our ability. I mean, our creation was as a result of social media, so it just makes sense to continue using social media as one of its most important tools. We do carry out, of course, on the ground, on field activities, which did take a little bit of a hit during COVID, but we're trying to get back up and do more. So I think right now I'm trying to see what I can do best in terms of child rights advocacy, both through CAP but also in my career.
I love that. And thank you so much for the work
Of
that you've
course.
done what are some things that you want to maybe educate the audience? How can we help?
I think one of the things that I am focused on right now is, given my field of pediatric neurology, I'm trying to ensure that are the most vulnerable children, which are children who have neurodevelopmental disabilities, which means that children with cerebral palsy, children with other developmental disorders, children with severe autism, for instance, are not subject to abuse, because we know based on the data that they're more likely to be abused. So that's one of my focus. And the other thing that I'm also trying to work on is ensuring that we are giving children the best start to life, because we know that the brain does most of its developing in the first few years of life. So ensuring that kids have the support they need to reach their fullest potential, do what they're capable of doing, and we are nurturing kids and investing in those early years. So I think those are my two foci, I would say, and that's what I'm trying to work on.
I'm excited to see where that work goes, and to learn more about how that plays
Mm-hmm.
out in the future. And I will definitely be tuning into what you are speaking about. So one thing that I want to know about is what advice or how would you say people can boost their confidence to speak up?
So that's hard. I wouldn't lie, especially for women of color, it's hard to be able to speak up in a voice where you are a minority, where people might look down upon you. People might have a lot more questions than they might have about other people. I think the biggest thing is, I think we've sort of reiterated that, like, believing in yourself, knowing that what you're saying is is from your lived experience, knowing that your voice matters, it is valid, and it is in fact needed, because your voice is lacking in this room right now. So ensuring that you have that confidence, and we all get imposter syndrome, recognizing that your feelings, your lack of confidence, or those feelings that you're getting are actually imposter syndrome.
Yeah, well put. I love what you said about how to build up your confidence and
Mm-hmm.
to add to what you're saying. I think remembering that you have a reason, you have your unique perspective, and you have your own unique experiences that shapes your opinions about something, right? So I think every voice deserves to be heard. Maybe sometimes it's not always about being the loudest voice, but maybe being the most truthful or like authentic
Mm-hmm.
voice. I've loved listening to your story of where you started off, as a 10-year-old yourself, wanting to be a doctor and having your vision for your life build up over time, and how you took the experiences that you had, like knowing about a missing child and how that inspired you to take action. Taking action is extremely admirable and it's not easy to do. I can't wait for people to know more about your nonprofit and also follow along your career as a doctor. And I love that you are a voice out there, and I love that you are setting an example as a female doctor out in the world, and the patience that I'm sure that it takes to be in that space, and all of the service that you do as a doctor. That's amazing. So thank you so much for coming on. I really appreciate you, and you've given a lot for me, and I'm sure the people who are listening to think about with everything that we spoke about today.
Thank you so much for having me on. Honestly, I love that you're doing this, and I'm grateful for the opportunity to share what my journey has been, and how there's some things that are overlooked, and it's so important for women of color to be represented, to be there, and to have the confidence to be who they are in spaces where they belong.
I love that. I think that's a great way to wrap it up. But thank you so much for coming on, Taha.